New data from an interactive online tool shows the risk of catching COVID-19 by getting together in groups of people.
In groups of just 10 people, the risk of someone there having COVID is 19% in Wayne County, 24% in Oakland County, and 30% in Macomb County. Just yesterday, the leader of the Henry Ford Health System said in their system, they're having the most mask issues in Macomb County.
And all this means the chance of a shutdown is much greater. Because Macomb County has these higher numbers, Nick Monticelli asked the county executive there why. Nick?
It was an interesting conversation with County Executive Mark Hackel discussing Macomb County, as it's been in the headlines lately, but it transitioned to more of a topic about a potential shutdown and his thoughts on if it has to happen, what really needs to happen to get everybody on board. Our second wave of COVID-19 has become such a dire situation that leaders of several hospitals are banding together, urging caution. On top of that, Henry Ford Health System said of all of its hospitals, this one in Clinton Township in Macomb County not only has the highest volume of COVID-19 patients, but also has the least compliance when it comes to mask wearing.
We see that not only in our facility with, at times, visitors who would come into the facility challenging our staff around our mask use policy, but also in that community.
But why?
What is it about Macomb County?
County Executive Mark Hackel says it's about being responsible.
This is a personal responsibility. You need to take ownership of this yourself. Keep yourself and your family safe by making the right decisions.
As for the possibility of another shutdown, hospital leaders say not yet.
I think none of us want to go through the shutdown and the brute force of what happened in the spring. I think we don't need to do that.
And if asked, County Executive Hackel would offer this to the governor.
I think I would rely upon the healthcare officials. If they're saying, yeah, we think it needs to happen right now because we're so concerned about the inundation, then you need to at least let people know. But if you're going to do that, you need to be very clear and concise as to how long we're looking to do this for and what we're looking to obtain specific in the data, the science, and the numbers.
He added if there is a clear goal line, an answer on what it will take to reopen, more people will buy in.
Because most people want to be part of the solution. Most people will want to kind of help out and be part of the team, I guess, if you will. But if you don't feel that, if you don't know what the real goal is or what we're trying to obtain here, that causes confusion. And sometimes people look at that as, okay, is it arbitrary? Are we doing this just because, you know, it's being punitive? And if you're doing that, that causes a lot of people to kind of, I guess, if you will, take a step back.
In Clinton Township, Nick Monticelli, Local 4.
And if you want to check out that interactive map for yourself, and it really is an interesting tool, we've posted a link to it right on the homepage of our website. Click on Detroit.com.